In this scenario, the nurse will be meeting with a young 21-year-old female patient who has come into the emergency room for treatment. The patient presents with a handmade sling cradling her left arm and also has a bruise on the left side of her face and a slightly disheveled appearance. The setting will be the room of a busy ER on the night shift. The night shift nurse just got report and is coming to help admit the patient and take her to her room. The room offers very little privacy and is only separated by a curtain. A patient in the next room is apparently in a lot of pain. We hear him yelling periodically. The goal of the interaction is to assess the patient for her injuries. As part of the normal assessment, the nurse will conduct a brief screening for intimate partner violence. The RN is to identify if the injury was truly a result of a fall or of intimate partner violence. Additionally, if abuse is present and the patient is in immediate danger, the nurse will need to get law enforcement involved.
I'm going to get you to your room. You're going to be here for a while. I'll lock this in place. Okay, here. I'm going to help you to the bed now, okay? I'm going to support your back and I won't touch your arm. And Chelsea, here's a gown. I just need you to undress so you put this on with the opening through the back. There's an extra blanket if you get cold, okay? And I'll come back and check on you in a few minutes. Are you ready for now? Okay, I'll check.
Close the card.
Sure. I'll be back in a few minutes to check on you. Chelsea? How you doing? My name's Marla. I'm going to be your nurse today. How you feeling?
Okay. My stomach hurts.
Your stomach hurts? Let me pull up the side rail. I don't want you to fall. Are you comfortable right now? Yeah. Okay. I've got some basic questions that I'll need to go over with you to kind of see what happened that brought you here today. Can you tell me a little bit about what happened? You've got a little fall there, it looks like.
I was getting ready to take a bath. Yeah, a nice bubble bath. And I think I tripped. I don't really remember. I think I tripped on a rug and I hit my eye on the doorknob.
Your eye?
Yeah.
Can I take a look at your eye? It looks a little... Oh, my goodness.
Yeah.
That must be very painful. I wasn't able to see that when you came in.
Yeah. I think I hurt my arm after I hit the doorknob. I fell down. It really hurts.
I see here on the report that I got, and I was listening to the other RN, and she was saying that you fell and you really severely bruised your arm. Can I take a look at it?
Mm-hmm.
I'm just waiting for the lab results. I'm just going to uncover a little bit.
Yeah.
You're shaking.
It's okay.
Are you all right?
Yeah, I'm just a little cold. Yeah, I just think I hurt my arm and it just hurts really bad.
Yeah, the lab results are back. It looks like you've got a spiral fracture. That's probably why it's so painful. I'm going to uncover a little bit more just so I can see your arms a little bit more. Is that all right with you?
Mm-hmm.
Okay. Oh, man, you got some bruising there. Can you move your arm? I know that there's a fracture, so I don't want to cause you any pain. Is it hard?
Why do you need me to move my arm?
I don't need you to move. I just want to take a look a little bit more without... It's very painful. Okay, that's fine. That's fine. Hey, Chelsea, just rest it there. It looks like you have some other red marks on your hand there. Did something else happen when you fell?
I don't remember. No, those are all scars, yeah, from accident.
I know that your left arm is very painful. Can I take a look at your right arm? Is that all right? Just take a look here. See how you're doing. Oh, you've got some bruising here. This looks like an old bruise. And can you tell me what happened here?
That?
Is that somebody bit you?
Yeah, I have a dog.
You have a dog?
Yeah, he bit me.
Let me take a look. What kind of dog was that?
Chihuahua?
I mean, just looking at that bite, I have a Chihuahua, and its mouth is real small. And this looks, I know it just looks like it might be more along the lines of a human bite. Is that what you think it might be, or do you know what happened?
I don't really want to talk about it
Okay.
right now.
Okay. Well, I'm here for you. Let's go through some of the other assessments so that we can get your arm taken care of. Get you taken care of. There are just a few questions I need to ask.
Okay.
And these are questions that we normally ask every patient that comes in. Okay, so this is not just for you. Physical violence against you and your family, or known any types of symptoms like that or conditions like that?
Well, when I was growing up, my parents used to fight a lot.
You used to fight a lot?
Yeah, they used to fight a lot. They're divorced now, so.
And in that situation, and I know these are probably difficult memories to think about, but was there any kind of physical violence associated with those interactions?
Yeah, my dad used to hit my mom.
Did you ever personally receive any of that violence?
Like once or twice, maybe.
Once or twice.
Yeah, just because I tried to stop them once.
You tried to stop them. I was really trying to protect your mom. And now in your life, do you ever feel any times when you might be a victim or in danger for your safety? Is your home safe for you?
Yeah. I'm just married.
You're married?
And my husband lives together.
Oh, okay.
And kids.
No kids? Okay. How's your relationship? Any concerns there for physical violence? No. Tell me a little bit more about what happened today. How you actually got the spiral bruise, because that's a very unique type of, the spiral fracture, because that's a very unique type of fracture. How did that happen to you?
Oh, I like I said, I was going to take a bubble bath,
Oh, nice.
and I tripped,
Mm-hmm.
and I think I hit my eye on a doorknob,
Okay.
and I think my husband was behind me, and he caught my arm before I fell
He caught
to
your arm.
prevent me from hitting the floor.
Oh, so he was trying to help you from falling? Okay. Was he helping with the bath? Did he prepare the bath for you?
No, I was feeling it.
You were doing it on your own? Oh, okay. And so Were you near the bath? I'm just trying to understand how, because you've got a lot of bruising, different levels of bruising. Some look old, some look new, and you've got the mark around your hand. Help me to understand what's really going on there, what's going on. Because I don't want you to be at risk like this for a simple bath to turn in. You've got some pretty severe bruising there.
Not just klutz.
Your klutz.
I trip a lot.
You trip a lot.
Yeah.
Chelsea, sometimes people, I know for me as well, might have difficulty sharing things because they might not feel very safe or comfortable. I want you to know, I'm your nurse. I'm here to protect you and take care of you. This is a safe environment.
I didn't fall. It's my husband. He hit me.
I'm so sorry.
I deserved it.
No. Chelsea, look at me. No woman ever deserves that. Chelsea, I know this has got to be very hard, the emotions that you're feeling, but it's really important that you tell me it really happened. Can you share that with me? Let me get you a tissue.
All my fault. We just got married a year ago.
You feel like it's your...
We were supposed to start having kids. And I got pregnant. And I lost the baby.
I'm so sorry. I'm so sorry for your loss. That must have been devastating.
It was all my fault. My husband blames me.
He blames you? Chelsea. I'm sorry. Tell me more. What else happened?
Ever since I lost the baby, things just got really bad with me and my husband.
How did they get bad?
He wanted to have another baby. I didn't want it.
You didn't want to?
I don't want to go through that again. I had to wait till I was almost full term to abort the baby. It was stillbirth.
Oh, no. That must have been very, very hard for you.
So, I didn't want to try to have a baby anymore. And my husband didn't like that.
You didn't like it?
He wanted to have another baby. He wasn't.
Do you think you might be pregnant now? And you just told me that you weren't really ready for that.
I didn't want a baby. I didn't want to have sex. I didn't want to do anything with him. He forced me into it.
He forced you.
But he says it's okay and that no one will believe me because we're married. And it's supposed to happen like that.
Chelsea, you said that people won't believe you. Can you tell me a little bit more about what they won't believe? Remember, this is a safe place. I'm here for you.
Well, I'm married, so if I don't want to have sex and my husband does and makes me do it, it's not right because we're married. But I don't want to do it. And if I don't do what he says, he just hits me. He just holds me down.
Chelsea, that's never right. Married, single, any woman, birth till death, should ever have anyone lay their hands on you. It's not right. being your husband doesn't give him the right to use you as a place for abuse. I want you to know that. But, so, when you said, I want to understand what's really going on. When you said that people wouldn't believe you, have you tried to talk to friends or family about what's going on? And
I don't see anyone. I'm just at home all day.
so,
And my husband doesn't let me go anywhere, and I'm too afraid to leave the house or call anyone.
do you want help? You want help? We can get you some support. But I need to understand a little bit more. At home right now, do you feel safe? These are just part of the assessment questions that I have to answer. Has he specifically told you he will physically harm you or kill you, or has he expressed any intent as far as plans for your life or your livelihood?
No, but he doesn't have to say I know it's coming.
You feel like it's coming? You feel scared for your life and your safety? Does he have any kind of weapons, or what kind of weapons does he have at home?
He likes to hunt, so he has a shotgun in his closet or in the bedroom where we sleep. Sometimes he's really paranoid about people coming into the house and breaking in, so he has a little pistol, and he'll sleep with it underneath his pillow at night.
Are the pistol or the shotgun loaded?
I think so.
Have you seen any of the ammunition out where people can reach that?
No.
No? Alright. Can you tell me more specifically about what really happened to you that brought you here today? How you got that? Any bruise on your eye? Is that a bite mark from him?
Yeah. I didn't fall.
You didn't fall.
No.
I'm glad that you're feeling better, that you can share that with me.
Yeah, I didn't fall. My husband got from work. Got home from work, and I didn't have dinner ready. I was too busy and trying to clean the house, and I didn't have dinner ready for him. And he came home and he was really mad. And he started throwing things that hit me in the face. And I tried running upstairs, but he just cornered me in the bedroom. He had nowhere to go. He was blocking me from the door and just pinned me in the bed. And I tried breaking free and fighting him off. He was too strong.
Was there any kind of intimate sexual violence in that time? Does that happen regularly?
Sometimes.
I know it's hard. When he gets into these moods, does he drink? Does he use any kind of drugs?
I think he drinks alcohol. Yeah, sometimes. But this time he just came home and
He
just lost it.
right from the get-go.
The scenario you just saw is real, and in fact, domestic violence and intimate partner violence happens to men and women alike every single day. If at any time you feel you have been physically, sexually, verbally, or emotionally abused, please call the national hotline, 1-800-779-SAFE, S-A-F-E. If at any time you feel you are in immediate danger, then hang up and dial 911. No one should ever be abused. Patient is a 30-year-old Hispanic female named Marisol. Prior to admission, Marisol took an overdose of sleeping pills, where her husband found her lying on the bathroom floor. Marisol has had 3 prior psychiatric hospitalizations, 2 for suicidal ideation and 1 psychotic episode with combative behavior toward her husband. Marisol has been diagnosed with dissociative identity disorder, also known as multiple personalities, and has suffered from 2 traumatic events in her past. Her husband, at age 4, Marisol discovered her father in bed with their 5-year-old neighbor and was thereafter forced to engage in oral sex with her dad for 5 years. Marisol felt guilty and cried for several hours, denying to herself what had taken place, and only got relief when she attributed what had happened to someone else, whom she called Pat. The second day, when approached by her father, she insisted on being called Pat. The second traumatic event occurred at age 18, when she ran away from home and was driven into prostitution by her ex-boyfriend. She began calling herself Nancy. This current overdose was attributed to her inability to cope with her responsibility as a wife and a mother of her 5-year-old daughter. Pat rejected Nancy and forced her to take the sleeping pills. The husband is worried about the safety of their child because recently Marisol blacked out and let the kitchen burn down while cooking. Husband is frustrated at the fact that Marisol seems to be shifting more between her multiple personalities, where she denies their marriage and child in front of them. For the setting, patient was transferred from the county ER and admitted to College Hospital on a 72-hour involuntary hold. The communication interaction will take place in an isolation room where she is staying. It has a bed and wooden table with dim lighting where she can be in peace and quiet. The nurse's objective is to interview and make a progress note of the patient's status. Goal of communication interaction. The first goal of this interaction is to establish trust and rapport with Marisol and the 2 alternate personalities in order to establish a good nurse-to-client relationship. Secondly, she needs to foster cooperation among the different personalities, since the reason for the suicidal attempt was the rejection of the 2 personas. Additionally, the goal is to reinforce reality and get to know each alternate personality as an individual. Hi there.
Hello,
What is your name?
my name's Marisol. You can call me Mari.
Marty, nice to meet you. My name is Chelsea. I'm a nursing student from Hondo, and I'm just kind of here to talk to you today, okay?
Okay.
So what brings you here to the hospital?
Is it okay if I talk to you about it?
Mm-hmm.
Okay, well, I was brought to the hospital because I was having a lot of problems at home, with my family and with my life.
Problems at home?
Yes, problems at home because I kind of I zone out or I black out, and when I wake up, things are different.
So you zone or black out? What's going on leading up to those events?
I don't know. Sometimes just the phone ringing, and if it's something that upsets me, or I just black out and I don't remember anything, and then when I wake up, when I'm there again, everything's different. The furniture in the house is different. Everything's changed, and I don't know why.
Okay, so let's take a couple steps back. You were talking about things that upset you. Can you tell me more about that?
Everything upsets me. Everything upsets me. I get angry because I don't want to be here. I don't want to be here. I don't want to be there. And people won't let me do what I want. I never get to do what I want.
What is
I don't even want my hair like this. I don't know who does this. This isn't, I don't want to be here. Who are you? Why am I here?
My name is Chelsea. I'm a student nurse from Hondo, and you're here at College Hospital right now.
I don't want to be in a hospital. This is stupid. I shouldn't have to be here.
Well, you're going to be here for at least 72 hours. You did attempt to hurt yourself, and you were brought in here by a gentleman.
Was he a cute gentleman?
It was your husband.
I don't have a husband.
Marisol's husband.
Oh, I hate that guy.
What is your name?
My name's Nancy.
Nancy.
Yeah, I hate Marisol's husband.
You hate
He
him?
always tells me what to do,
Mm-hmm.
and he keeps me away, and he prefers Marisol, and he's not even cute. He's like really fugly.
What does he make you do? What do you not like about him?
He doesn't let me express myself.
Mm-hmm.
I need to express myself. I'm all about expressing myself and being free, and he doesn't let me be free. He wants me to be gone, and I can't do that. It's not fair.
He wants you to be gone, like out of the house, or?
No, he wants me to stay in the house, and I want to go out.
Uh-huh.
I want to go out, and I want to have fun. I'm young.
Mm-hmm.
I shouldn't have to stay in the house.
How old are you, Nancy?
I'm going to be 18 soon.
Okay.
I'm going to be an adult. I should be able to go out and do whatever I want. I want to go see other people. I want to go hang out with friends. I want to be with guys, and he doesn't like that. And he makes me so angry. And when I get angry, I have to do things. I get angry with him, and he gets in my way, and he won't let me out of the house. So of course I have to react.
What are some of the things you do when you're angry?
We get into fights, but I always win.
When, how?
Well, he stops. I hit him. He won't hit me. I can't hit a girl, especially not a girl that's pretty. Seriously?
Mm-hmm.
Of course I win. I always win.
How often do you fight with him?
Whenever I come in contact with him, I hate him. I don't like him. He likes to think that he's my dad, and he's not my dad. I don't need a dad.
Nancy?
I'm sorry, what?
Hi there.
Hi.
How are you doing?
I'm okay.
What's your name?
My name?
Mm-hmm.
Why do you want to know my name?
Well, my name's Chelsea. I'm a student nurse from Rio Hondo, and you're here at College Hospital. Can you tell me your name?
I don't know. I'm not supposed to talk to strangers. I don't know you.
Okay, that's fine. Do you want to get to know me and I'll get to know you for a bit? This is a safe place. You can tell me whatever you like.
Is that okay with my mommy? I don't want to upset my mommy or my daddy.
That is fine. I'm your nurse. This is a safe place. You can discuss whatever you'd like with me.
I don't know what disgust means. But my name's Pat.
Pat, nice to meet you, Pat.
It's nice to meet you. What was your name again?
Chelsea.
Chelsea. Sounds like the ocean.
Yeah.
Sea.
So what's on your mind, Pat, right now?
This place is weird.
Weird how?
I don't know. I don't know how I got here,
Mm-hmm.
and I don't know. It's a little confusing, but I don't know.
Do you know where you are right now?
In a room,
You're in a room. You're at College Hospital.
hospital.
Mm-hmm.
Did I get hurt?
Yes, you did attempt to hurt yourself.
Oh, I wouldn't do that. That would upset mommy and daddy.
Upset them?
They would get upset, and I don't do things that upset mommy and daddy. I'm a good girl.
How are you a good girl?
I like to play, and I like to color, and I like to
Uh-huh.
listen, and I do as I'm told. I'm a good girl. I don't ever upset anybody, and I don't ever do anything that I'm told not to do. I don't go near boys. I don't. I stay away from boys.
Okay.
Do you have any candy?
I do not, but do you want to color?
I'd love to color. Can I color? I want to color. How many
Okay.
colors do you have?
Let me see. paper, Pat. And we have a bunch of colors.
I get a color on the paper, but I don't get a color on the cushion, right?
Yes, only the paper. So go ahead and just draw whatever's on your mind right now.
I want to draw you. Can I draw you because you're really pretty?
Sure.
Okay.
And if you don't mind, as we color, I can kind of talk to you, okay?
Okay. Chelsea, why are you here?
I'm a nurse. I'm here to just help you talk, just see how you're feeling. How are you feeling right now, Pat?
Right now I'm happy because I get a color, and I like to color because colors are pretty.
Yes.
Do you think I'm pretty?
Yes, but let's go back to the coloring. Let's talk a little more about you. Can you tell me a little about yourself?
My name's Pat.
Uh-huh.
I like to color.
You like to color?
And I'm 5 years old.
You're 5.
5-year-olds like to color.
Do you go to school?
Not really. No, I used to go to school, but I stopped going to school.
You stopped going to school?
Yes. I stopped going to school because Mommy said I didn't need to go to school anymore. But I miss my friends. I miss them a lot. But I always do what Mommy and Daddy say. And I'm a good girl, so I don't go to school.
What type of things do Mommy and Daddy say for you to do? Give me an example.
Well, Daddy usually tells me what to do, and Mommy usually just agrees. But Daddy tells me to stay away from boys, and Daddy tells me to stay in my room, and Mommy just agrees. So that's what I do.
Stay in your room?
Yes, I stay in my room. I don't ever go out of my room, except when I play with the little girl.
What little girl?
The little girl that lives in the house in the other room.
What's her name?
Her name's Kathy. I call her Cat. It's like a kitty cat.
Oh. How old is Kat?
She's also 5. She's just like me.
Oh.
And she's pretty too.
What type of things do you like to do with Kat?
Oh, we like to play with dolls,
Mm-hmm.
and we like to play hide and go seek.
Uh-huh.
One time Kat wanted to play in the kitchen, but Daddy wouldn't like that, so I told her we couldn't, but she said we could, and she went in there alone, and then bad things happened.
What bad things happen?
Well, I went in to check on her.
You seem a little upset right now, Pat.
I didn't do it. It wasn't me.
You didn't do what?
No, it wasn't me. It wasn't my fault. I'm
What
a good
wasn't
girl.
your
I
fault?
don't do things. I don't play with fire. Daddy doesn't let me play with fire. I don't play with fire. It wasn't my fault.
What wasn't your fault, Pat? Tell me more about it.
But it was hot. And there was smoke. But it wasn't me. It wasn't me. I didn't do it. It wasn't me. It was Kathy. I told her not to.
What did Kathy do, Pat?
She put her daddy's tie on the stove, and it was hot, and there was smoke, and I couldn't breathe, and I coughed, and I coughed, and then he came in, and he was angry, and and our hands.
No, that's for the machine to.
It's all right. Take your time. If you don't want to talk about it right now, that's okay. We can talk about something else. Pat?
Who's Pat?
Hi there.
Hi again.
Is this Nancy?
Who else would it be?
We were just talking to Pat earlier.
Oh, Pat. Poor little Pat.
Why poor little Pat?
I'm assuming this is yours.
Thank you.
Yeah, it's not very good, is it?
So why poor little Pat?
Oh, she's so scared all the time. And she's so timid and so weak and disgusting. We don't let her come out much. She doesn't get to play.
So, how do you feel about Pat?
I don't like her.
You don't like her?
No, she's bratty and she's little, just like that other little girl, little brat.
Now, how old
Always
is
in
Pat?
the way. Pat is 5,
Mm-hmm.
just like that other little girl. They're both brats, and they get on my nerves.
The other little girl?
Yes, Marisol's daughter,
Uh-huh.
Catherine, I believe her name is.
Mm-hmm.
I can't stand children. I never want to have any children of my own. I just want to have fun. I want to go out and I want to party, and I want to meet guys, lots of guys,
Mm-hmm.
and never have children. It's stupid for people to have children. Children are dumb. Do you have any children, Chelsea?
You know, I don't, but let's not talk about me. I want to hear more about you, Nancy, okay?
What do you want to know? My life's an open book.
Well, start wherever you'd like. Tell me more about yourself.
Well, I don't go to high school anymore because that's just stupid. And anyway, my boyfriend says that I don't have to, so
Your boyfriend?
yeah, well, ex-boyfriend. He wasn't really my ex-boyfriend. He was more Marisol's ex-boyfriend, but I took him. He wanted me more anyway. I knew he wanted me. He was just using her to get to me.
Using her. Tell me more about that.
Well, he pretended to like her,
Uh-huh.
and he would go out on dates with her, but she didn't like him very much because he was a little too hands-on, if you know what I mean.
Oh, no, I don't. Can you?
Well, like, you know, we would get frisky,
Okay.
and she didn't like that, so she would fight him.
Okay.
And that's when I would come out, because I knew he was calling me. He wanted me. I knew he wanted me. Anyway, Johnny said I didn't have to keep going to school anymore, because who needs school? You can make money having fun. So that's what I did. Whenever Marisol got in the way, he would just get frisky, and I would come out and play, and we would play, and I liked it. And then I started playing with others, and I liked that because that got Johnny money, and when Johnny had money, he'd buy me whatever I wanted.
Now, what do you mean, Nancy, by play?
You know what I mean?
I don't. Can you tell me?
Well, I would let guys do whatever they wanted with me.
And what were some of those things?
Some just wanted to kiss and touch. Others wanted more. I like those.
More.
We'd have sex, stupid. What do you think I mean?
Okay. No, thank you for clarifying. I didn't know.
You're obviously a virgin.
Let's talk more about you, okay? So how did that make you feel? Being with all the men?
It made me feel amazing like I am because they all wanted me and I know they wanted me. I know they still want me. If I can get out of here, that's what I'm gonna do. I'm gonna go out and I'm gonna party and I'm gonna have fun.
Okay. So how do you and Pat get along? How's your guys' relationship?
She's like that annoying, nagging little sister that always wants to tag along.
Mm-hmm.
I don't like Pat. She's always there. There's nothing I can do about that. She bugs and she asks questions. I say things to her that I know will upset her.
What kind of things do you say to Pat?
I start talking about the guys that I hook up with
Uh-huh.
and the things that we do, and it drives her crazy because she's a good little girl. I think it's funny.
Okay. Pat's very young, too.
She is, but she's never gonna grow up.
In this scenario, the nurse will be meeting with a middle-aged woman who is in hospice care for stage 4 breast cancer that has metastasized to the lungs. The patient is prideful and hesitant to connect with her estranged daughter in regards to her condition. The patient has been recently placed on hospice care and is misinformed about what this means. She has not shared her health condition or process with anyone but her oncologist. Because of the severity of her condition, the patient is fearful of being alone. Setting. This meeting will occur in the patient's living room during the initial hospice care visit. The patient lives alone but does have a neighbor who checks in on her periodically. The goal of this interaction is to inform the patient on hospice care while implementing the SPIKES model of therapeutic communication to assess the patient's knowledge and coping mechanisms.
Knock, knock, Mrs. Guerrero.
Oh, come on in, it's open, hon. Who is that? Who is that?
Hello, Mrs. Guerrero. My name is Marisol Rodriguez,
Oh.
and I'm going to be your nurse from Friendly Hospice.
Yes.
Is it okay if I come in and talk with you for a little?
Yes.
Is it alright if I use this chair right
Oh,
here?
please do. That's where that other lady, I forget her name, she comes. My neighbor, she sits right there.
Oh, your neighbor? She comes over often?
Yeah. Oh, a couple times a week she comes over.
Well, that's good.
She's nosy.
Oh, I'm sure she's concerned for you.
Yeah.
Now, Miss Guerrero, like I said before, my name is Marisol, and I'm here from Friendly Hospice. Did you know that I was coming to visit you today?
My doctor, he kind of said something. He said something about some lady coming, and they're always so busy. He never really explains anything, and
Okay, so I'm from Friendly Hospice, and I will be coming by periodically to check on you. You order your medicines when you need them, check on your pain. Since this is my initial visit, I'm here just to assess how you're doing, answer any of your questions, things like that. Do you understand what hospice is and why I'm here visiting you?
I honestly don't. When they said hospice, I'm like, well, I was in the hospital and I left the hospital, so what's hospice?
Okay, so nobody explained this to you yet.
They just don't really explain much of nothing to me. So,
Well, I'm here to answer any questions that you may have. How about we start with, I see in your chart that I have here that you had breast cancer? Yes.
Yes.
And you went through chemo and everything.
honey, if you ever have the breast cancer, tell them just to chop it off. Because the chemo, I was sicker than a dog. I couldn't keep food down. It just felt like my insides were coming out. It was horrible. Horrible.
That can be very, very difficult. Tell me, Miss Guerrero, how much do you know about your condition?
Well, I don't really know. I don't understand it. They said it was stage 4, but I don't know if there's 20 stages or is that the end of the line or, because it's cancer, just the whole word makes me, I don't want to think about it. My daughter, she's so nosy, she calls and she just sounds like she's more than waiting so she can get the house.
So your daughter knows about your condition?
Not really. I mean, well, I try to keep things to myself. I'm kind of private. I like to keep to myself and not, share things about my condition.
Are you okay sharing with me? Is that okay with you if we talk about your condition for a little?
Yeah, you seem real nice, like you're real interested in what's going on, so I'd like that.
I'm very interested. So what I want to talk to you about is your condition. Have you found out how much would you like to know about? I see that you said the doctors don't really explain anything to you.
No.
No. Is that because there's certain things you don't want to know, or are you afraid to ask? Do you want to know everything about your condition? How much do you want to know?
Well, you kind of hit on the point there. It's scary, because you get to I don't know, but it feels like I'm kind of coming to the end of the line. Like my life is just, it's time, and I want to know, but I don't want to know. It's so scary,
It's very confusing, very scary, yes. How much would you like to know about your condition and the situation, this hospice situation?
Well, can you tell me, are there any other options?
I noticed that you had a question about the stages. You do know you have stage 4, and there are only 4 stages.
Uh-oh. That doesn't sound very good.
What this means, Ms. Guerrero, is that we have used all the options that we have available at this time to treat your condition, and they have not been enough for your condition.
Cancer's a little stronger than what y'all can do.
That is correct.
Damn it. There's nothing?
There is hospice, which is what I'm here to do for you. We come to your home as much as is needed, and we help keep you as comfortable as possible as your disease progresses, because it is going to progress. Your disease is going to progress, and as it progresses, there may be some painful times, and we will be here with you to provide management of that pain, provide information.
Pain? It's gonna hurt? Oh, please. It already hurts a lot as it is. It's gonna be worse?
Well, that is what we're here for. We will be providing pain management to help decrease that pain, the pain that you're feeling right now, the pain that you've been feeling from the cancer. We're here we will medicate you if that is what you would like. We are here to provide you with information. If you need anybody to just talk to, we're here for that as well.
So I could be able to call somebody, because it's nice to talk to my neighbors sometimes, but it just hurts sometimes real bad, and I don't know what to do, and even sometimes getting up to the bathroom is hard. The pain is just so bad at times.
How does knowing that you're in stage 4, what are you thinking right now? How does it make you feel?
Oh, well, in a way, because the doctor wouldn't tell me nothing. He would kind of like dance around it. And like, you know what? Tell me straight out. And you told me. So in a way, it might make me feel a little bit better, because at least I know I can start kind of planning. So you're the first one to actually come and tell me what's really going on. Maybe they tried to tell me before, but I guess when your brain's not ready to hear it, you just kind of block it out.
And that's something else I'd like to talk to you about. Is I understand that there's going to be questions that are going to come. Sometimes you're not going to not necessarily remember, but maybe not hear everything that the doctors are telling you or that the nurses are conveying to you. So those are things that I can help you with, help you to understand. You will also be going through several stages. It's not easy, like you said. This is a very difficult time, very difficult information, and sometimes you may feel angry, sometimes you may feel upset. All of these things are very normal for you to be feeling, and for also your family, your daughter, when you do tell her, you understand that she will also be going through anger, denial. If there's any help that you need, that your daughter needs, if she has questions, she can also get a hold of us. We can meet with her, we can talk to her about it as well. We can, as a group, if you prefer, if it's okay with you.
That would be nice, because I can't really talk to her sometimes.
Okay, and we can do that. We can help you to express what it is that you would like to tell her. If she has questions regarding your condition, we can help her understand that too.
The thing that scares me the most is not the pain, because I can kind of grit through that. It's just being alone. When that time comes, the moment, I don't want to be alone. I don't want to be alone.
You won't be alone. We will be here with you through all of it. Till the very end, we will be here with you. You will not be alone.
That's the scariest thing. You can end up alone on your deathbed, and that ain't a good place to be.
No, it's not, and that won't be you, because we will be here. Okay? We will be here through the medicine. We will be here through everything, with your daughter, with yourself, making plans. We can help you with all those things.
So, let me ask a more practical question. Like,
Go right ahead.
okay, so when it comes time, will you know? You don't die every day. Will you know? Will you feel it? Will it hurt?
Those are all very good questions. It won't hurt, because we will be medicating you, like I said. We'll do our best to not let you feel the pain at all.
Please. Just me.
When it is time, we cannot say. I can't tell you you have a week, a month. Your disease process is different from everybody else's disease process. Sometimes it takes a while. Sometimes it goes by fast. Hospice is generally implemented when there's about 6 months left. That does not mean that you only have 6 months, but it also doesn't mean that you have more or less. It can go either way. It can be a week. It can be a year. That's just the standard for hospice care.
Oh,
But
I wasn't asking about the specific time. I think that's up to God. I was more thinking like when it gets close.
Mhm.
Will you know, so that somebody can be sitting here holding my hand? That's what I want. I want someone to hold my hand at that moment, so I'm not alone. I don't want to die alone. I do not want to die alone. That would be worse than the pain.
I understand that it's very scary, and it's not knowing. It's very scary. You won't be alone. As your disease process gets further, as it progresses, we will be coming more often. It's going to get worse, and as it gets worse, you are going to need more help. So we will be here more often. When the time gets nearer, it is possible for us to have a nurse here 24 hours.
Oh, that's nice. That would be
Yes.
so nice.
You will not be alone.
That means so much. You don't know how much that means to me.
Here, Miss Guerrero, and I don't want you to worry about either of those things. We will take care of those things. You will not be alone, and you will not feel pain. We'll do our best to make sure you do not feel pain.
Sign me up.
Okay, well,
Help
this
me out.
is our contact information.
Oh,
The
okay.
number Friendly Hospice is right here. This is our name. Here's the number. If at any time you need us, you may call us. Also, any nurse that comes in here will be identifying themselves as Friendly Hospice. They will be carrying a badge, and so those people you can let in. And we will be calling you ahead of time to let you know when we're going to be coming by on visits. The next step is going to be to get together your advanced directives. Do you understand what that is, advanced directives?
It's where you kind of say what you want.
Yes.
Okay.
Yes, it is a plan. So we're going to create a plan. Would you like me to schedule that? I can come as early as tomorrow. We can schedule that so that you and I can do it, or we can wait for your daughter to come and we can do it together. It's up to you.
Oh, that would be nice if my daughter's coming on Friday. If you
On
could
Friday.
come on Friday, She's gonna be here about 1.
1 o'clock Friday sounds perfect. I can be here at 1 o'clock Friday and we can go over that paperwork and get you all signed up and started. If there's any questions that you have from here till then, feel free to dial that number right there and call me.
Good, because I want no pain. I want someone here with me, and I don't want to have them poking and prodding me, and just I just want to go quiet. I don't want a big fuss.
Okay,
I
and
just
I'm
want
here to
to
make
go.
sure that that happens the way that you want it to happen.
Well, that'll be nice.
Well, it was very nice meeting you, Mrs. Guerrero.
Same here.
I'm gonna get going now.
Okay.
You have the folder. Go ahead and
Thank
call
you.
me if you have any more questions.
All right. Thank
Okay.
you. Thank you.
All right, you have a nice day.
All right, you too. I'd get up and walk out with you, but it's kind of hot.
Oh, it's okay. I'll see myself out.
All right. Well, thank you now.
There you go. All right. Goodbye, Mrs. Guerrero.
Bye now.
I'll see you Friday at 1 o'clock.
All right. I'll be waiting.
Need to take a held on, 'cause I've lost my mind. It's